Welcome to another episode of Uncovering Bailey in Love with Snazzy Surgeon. All right, so today we're going deep on congenital breast abnormalities. It's not something we see every day, but, it's important to be aware of the possibilities.
Yeah, absolutely. It's one of those things that can really trip you up if you're not prepared for it.
Exactly. So let's start with Amazia.
Amazia.
So this is the complete absence of breast tissue.
Right. Congenital absence.
From birth.
Yeah, can be unilateral or bilateral, but unilateral is definitely more common.
And what's that key association we got to keep in mind?
Well, particularly with the unilateral cases, you have to think about Poland's syndrome.
Poland's syndrome.
Yeah, so you're not just missing the breast tissue, you're also missing the sternal head of the pectoralis major muscle.
Wow.
And you often see symbricodactyly on the same side.
Symbricodactyly.
Yeah, basically it means the fingers are short and webbed. It's a pretty striking finding.
So it's all connected, kind of points back to that shared embryological origin, huh?
Yeah. Exactly. The chest wall and the upper limb develop together. So if something goes wrong in one area, it can affect the other.
Fascinating. So when we see a patient with Amazia, especially unilateral,
Red flag right there.
we got to check for those other Poland's features.
Absolutely. Got to do a thorough exam.
And surgically speaking, what's our approach here?
Usually we're looking at reconstruction.
A reconstruction.
Yeah, we often use a latissimus dorsi muscle flap to give us the volume and coverage we need.
And then?
And then we can use a silicone implant to get the shape and size right.
Makes sense.
Yeah.
All right, let's move on to polymazia.
Polymazia.
So this is where we see accessory breasts or supernumerary breast tissue.
Right, so instead of the usual two breasts, you've got extra breast tissue developing along the embryonic milk line.
Interesting. So where do these usually pop up?
The most common spot is the axilla,
Axilla? Okay.
but you can also see them in the groin, the buttock, even the thigh.
Wow, all over the place.
Pretty much anywhere along that milk line.
And it's easy to just brush these off as a cosmetic issue.
Yeah, but we can't forget that this tissue is hormonally responsive just like normal breast tissue.
Meaning?
Meaning it can change during puberty or pregnancy lactation.
Yeah.
You might see enlargement.
Ah, see.
And even more importantly, it carries the same risk of breast disease, both benign and malignant.
So we got to treat it with the same seriousness as we would any other breast tissue.
Exactly. Got to keep an eye on it.
And are there any other congenital anomalies we should be thinking about in patients with polymazia?
Yeah, there are a few things to be aware of.
Like,
We can see vertebral anomalies, cardiac arrhythmias, and even renal anomalies.
wow, so a full workup is essential.
Absolutely can't be too careful.
All right, switching gears now, let's talk about mastitis in infants.
Neonatal mastitis.
It's not super common, but it does happen.
Right, and it can affect both boys and girls.
And the main culprit here is
Staphylococcus aureus.
Staphylococcus aureus.
That's the one we usually see.
Okay, good to know. And finally, let's touch on macromastia.
Macromastia.
So we see this in adults too, but it's the truly massive, disproportionate enlargement that makes it congenital.
Right, so we're talking about benign but huge enlargement of one or both breasts.
And what causes this?
Well, it could be a lot of things.
Right.
Sometimes it's idiopathic, sometimes it's linked to obesity.
Obesity, okay.
Hormonal influences can play a role too. Either the body's producing too much hormone, or the breast tissue is extra sensitive to normal hormone levels.
I see.
And in some cases, it might even be due to exposure to exogenous hormones.
So a lot of different factors can be at play.
Yeah, it's a complex condition.
And when we see a patient with this level of macromastia, what are our surgical options?
The most common approach is reduction mammoplasty,
Reduction mammoplasty.
where we remove the excess tissue and reshape the breast.
Okay.
But in really severe cases, we might consider a subcutaneous mastectomy with breast reconstruction.
Right. So we tailor the approach to the individual patient.
Exactly.
Well, this has been a great overview of these congenital breast anomalies.
Yeah, it's a good reminder that even though they're rare, we need to be ready for them.
Absolutely, because they really highlight how complex breast development can be.
For sure.
Thank you for listening to our podcast. See you in the next episode.